Hello, my name is Dr. Aditya Gudhate. I'm a consultant neurologist working in the Other West in Park Polyclinic. I would like to take a few minutes to talk to you about epilepsy, and in particular, I would like to talk about what happens if you're not able to tolerate your anti-epilepsy or anti-seizure medications. So, anti-seizure medications, like all medications, like painkillers, antibiotics, have side effects, and they are no different in that regard to other medications. So these anti-seizure medications act on the brain. So initially, when you start taking them, you may experience drowsiness, some sleepiness, some nausea, or unsteadiness, dizziness while walking. These effects are usually temporary and wear off within 1 or 2 weeks. When you start these medications, your neurologist will explain them to you, and obviously, you should ask yourself, your neurologist, about these side effects. Then, if these side effects sometimes in some patients, unfortunately, are long term, they persist or they may be severe enough to such that you may not be able to have the medication at all. In that case, you should immediately consult your neurologist, and then they may reduce the dose of that medication, switch to a better tolerated medication, or may stop the medication altogether. But it is important to highlight or important to understand that you should not stop the medication by yourself. Always consult your neurologist, because if you stop them yourself, you may have a bigger or severe epileptic fit. Then these anti-seizure medications or anti-epileptic medications often have long-term or chronic side effects. These effects, however, are predictable and mostly will be explained by your neurologist to you when you start the medications and as you continue to take follow-up. Many medications have such that they cause osteoporosis or weakness in the bones, but this may be prevented by taking regular calcium supplements. And in elderly patients like above 55 or 60 years old, you may undergo bone densitometry or DEXA scan to look for early changes of osteoporosis and prevent your bones becoming brittle and you falling down and having fractures. And I would also like to again emphasize that even if you're having any of these symptoms that you may suspect are due to medications, you should report them immediately to your neurologist, but don't stop taking the medications yourself. Then, like with all these medications, there may be sometimes the side effects may be severe, such as with lamotrigine, there may be severe skin reactions. With valproate, there may be liver related dysfunction. In case of phenytoin, there may be some changes in your gums or some jaundice like symptoms that may occur. These are considered to be severe side effects, and you should consult your neurologist or nearest doctors in an emergency. With I feel that with proper consultation, with proper follow-up, your neurologist and you will be able to manage your epilepsy much better. Thank you.